Hi, welcome. I'm Dr. Brandon Adams, and today we're here to talk about thyroid conditions. The reason we're talking about thyroid conditions is a lot of people that come through my office have signs and symptoms of the thyroid, and they don't suspect it. So what we're going to do is talk about some of the major signs and symptoms so you guys are aware of what the thyroid is all about. Alright, so one of the first major signs of the thyroid is a decrease in energy. Now this is the person that goes through their day and they don't have the energy to feel like they can complete all their tasks like they used to. They come home from work and they just want to go to sleep. They have no energy to do anything extra. The next point we're going to go through is an increase in weight gain. Now this person is the one who eats a low-calorie diet and still cannot lose any weight. They keep gaining. They have that excess belly fat, and not in anything they do, they still gain weight. Whether they're exercising, eating like chicken, vegetables, they still gain weight. The next point is a morning headache that ends up wearing off through the day, but they always wake up with the same chronic, dry feeling headache. Okay. Well, the next point is an increase in depression. Now, without the thyroid hormone really gets your energy and metabolism going, and when the thyroid hormone starts to decrease in its function and ability, then the person starts losing some of the get up and go drive, and then they start getting more complacent, sitting around most of the day, and then they fall into that depression category. The next point is constipation. The thyroid hormone also has a lot of ability for the metabolism of food, so getting the bowels moving and getting everything, all the toxins out, it becomes a lot more difficult and laborious. The next point we're going to go to is an increase in sensitivity to cold weather. So this is the person that's always cold. And that's because the thyroid does a lot of the heat metabolism for the body. So when you start losing that ability, then the slightest room that everybody else may feel real comfortable in, this person has to wear a jacket to feel comfortable. And our seventh point we're going to talk about is a decrease in blood flow to the hands and the feet. This is going to be the person that always has the ice cold hands no matter where you are, whether you're in 100-degree temperature or not. So they're going to touch your face and they're going to be ice cold. And this is going to happen with the hands and in the feet. Our next point is going to be an increase in muscle cramps. Now this is going to happen because the body is going to try to get to the blood flow and energy to the muscles. And when it can't do that due to the decrease in thyroid hormone receptor sites on the muscles, the body's going to try to spasm up the muscles to try to get more activation to them and try to overcome this problem. So that's why you're going to see that increase in those muscle spasms just when you're at rest. The next point is going to be a person that's always sick. This is due to the thyroid hormone and its response with the immune system. When the thyroid activation hormones start to decrease, so does the immune system. So this person will catch mostly every virus, bacterial infection that is out there. And they're also going to heal a lot slowly than the normal person would. The next point we're also going to talk about is a decrease in wound healing. So this is going to be the person that has the bruise for 6 weeks before it starts to heal up, going to get a cut, and it's going to leave a really dark scar and things like that. And that also has to do with the immune system, the way the inflammation works, and everything's just going to labor on a lot longer than it normally would. Alright, our 11th point is a person who needs a lot more sleep to function. They'll sleep 10, 12 hours a night and still feel really tired in the morning and just can't get their day going like they used to be able to. And our 12th point is going to be the person that starts to have changes in their hair, whether it be dry, brittle hair, thinning of the outer third of the eyebrow, which is really common when you see someone with a hypothyroid. And the person's also going to start to lose part of the hair. It's going to be real thin. You're going to see some of the bald spots. Okay, now this is mainly for all hypothyroid. Now on the other end of the spectrum, you have the person with the hyperthyroid. So the thyroid is producing too much hormone. There's too much activation. This is a lot less common than the hypothyroid is. So when you're dealing with the hyperthyroid, you're going to see the person that's always sweating, real energetic. They're going to be a real thin body. Their eyes are just going to be a little bit more popped out, and it just looks like they're on edge all the time, really shaky and jittery. Now that's a lot less common than hypothyroid. Now I'm going to tell you one thing about the hypothyroid, and this is where most medical doctors get it wrong. 90% of hypothyroids in the United States are all autoimmune conditions. So this is where the big difference is between where the medical doctors start to treat you and then things that we may do that differ, that help out a lot more. So now we're going to talk about some of the things that we can do in our office that differ from the medical community that may be able to help you. Okay, so some of the main things that we do is we like to treat the patient metabolically and neurologically. So the metabolic side, so basically that's us looking at blood work, other kind of tests to see what your body's doing and where it can have some improvements to maybe help out with overall body function. Since we don't go at your thyroid directly, we like to treat other areas of the body to make sure they're all properly functioning. And so some of the tests that we do, first of all, we got to have a full thyroid panel. Now, when a medical doctor usually runs a thyroid test, they do a TSH and a total T4. That's 2 tests. The full thyroid panel encompasses like 8 to 9 of those tests. And the medical doctors, they base your thyroid off just the TSH if it's low or high, and then your T4 if it's low or high. That tells you one part of the story. The whole ending is over here. So what we need to do is run the full thyroid panel so we can look at your TSH, the T4, the free T3, the total T3, the reverse T3, the free thyroxine index, and then we can look at TPO and TPG antibodies, and this is what's really important. Most of the medical doctors, they don't run the antibody tests. So the antibodies to the thyroid is one of the keys to knowing what is going on with it. So if you have the antibodies to your thyroid, that means your body is attacking your thyroid, and anything you do to help that you think may be helping, whether it be taking the hormone replacement therapy, that's the medical model treatment for thyroid is hormone therapy, and that model was made in 1961 and hasn't changed since. Okay? So after we run the thyroid panel, we want to get a look at what the other body's doing, so we run the complete metabolic, we run the lipid panel, and then we also do a complete CBC with the auto differential, so we can look at monocytes, erythrocytes, white blood cells, and other things like that. So we know if there's some parasitic infection, or they're having allergic reactions to things. So that tells us a great deal about what the body's under stress-wise. Okay, so we do the CBC. And then, this is like one of the main things. Then what we also like to do is run sensitivity testing. So sensitivity testing is basically the way your body reacts to certain kind of foods, mainly gluten. So if your body is reactive to gluten, then every time you eat it, it's like taking a bite out of your thyroid as well. A little bit of your thyroid dies each time you eat gluten. So we like to run the sensitivity testing to gluten, and that tells us a huge part of what you got to stop doing to help yourself get better. Now we also like to check out to see if you're sensitive to gluten, dairy, milk, soy, yeast, and other things like that. So if you're if you're sensitive to any of that stuff, you gotta cut it out. If you don't, you won't get better. That's the bottom line. Now after the sensitivity testing, we like to do an ASI, which is Adrenal Stress Index. So that takes a look at your adrenal glands. Your adrenal glands produce your cortisol, your adrenaline, and things along that nature. Now if your cortisol is really high, you're also going to be under quite a bit of stress. So we like to see what they're doing in response to the body. And the adrenal stress also deals a lot with your blood sugar regulation. So blood sugar issues are another reason why your thyroid can be going under some of these changes. Okay. Now, as I was talking about the thyroid and the antibodies to it, we like to run the immune panels. The immune panels, we basically look at the T and B lymphocytes, cytokines, and that tells us what side is heightened. You have a Th1 and a Th2. So if your Th1's up, that's your body going out and chronically attacking different things, organisms, so your body's under stress from something outside. Now if your Th2 is elevated, then that's more likely the autoimmune side. Your body's attacking yourself. So we really want to know what side's elevated, and we can do that by looking at these immune panels. Kind of along with the immune panels, we have a CD4 and CD8. And a CD8 ratio. Now that ratio has a range about 1.2 to 2.4, and if you're higher than the 2.4 or 2.9, then that kind of tells us that there's an active antigen, whether it be a parasite, you have a yeast infection, you're having heavy metal toxicity. So it kind of leads us into looking at things along that nature that could be causing some of your problems. Now if it's below about 1.2 or below, then you're looking at more of blood sugar, anemia, autoimmunity, just stuff like that. That's more where you're looking. So this helps us kind of get a good idea of where to look for the main problem. Okay. Now, along with all this stuff, another thing we like to run, especially when it deals with this, is an intestinal permeability panel. Now, this lets us know the integrity of your gut and your gut lining. So if you have a gut that's leaky, this is what they call a leaky gut. And if you have that, then the things you're eating is coming through and going down into your stomach, and then when it gets in the lining, it can actually go through it into your blood system, so your body is starting to build up reactions to what you're eating. And this is where you really get some of that food sensitivity. And then gluten, like I said, is one of the major ones. Now another thing that's really important about your gut is about 20 to 30% of your thyroid hormone is converted into the active T3 form inside of the gut. The major part is it's converted in your liver, so that's why we run all these complete metabolic panels, so we know the integrity and the function of these these organs. So if your liver's not functioning like it should, then you're going to start losing some of the thyroid hormone getting conversion there. So liver, your gut's another place, and then your cells is where another place it gets converted into the active T3 form. That's the form that allows you to start, feeling like you're young, active, and you don't have those hypothyroid signs. Okay? And another thing we like to check as people get older is your hormones. So we like to look at your testosterone, your estrogen, progesterone, DHEA, and things along this line, and that lets us know where you're dropping off. If you have increase in testosterone, decrease in estrogens, this lets us know where we gotta start looking at to get the body to get back to the young, youthful, exuberant form that you used to be. So hormones are important. Now this is the metabolic side, which is very important to look at. Now, one of the things that really sets us apart from other practitioners is what we do neurologically. So what we mean by neurologically is we look at the brain and what it needs to survive. It needs two things. That's fuel and activation. Now fuel comes in the form of oxygen and glucose. What we like to do is we like to push your body up to an oxygen concentrator. So we're pumping oxygen through your body, and we like to put you on exercise while doing this. Now this enhances the effect of the oxygen concentrator, gets the oxygen into the blood, gets it flowing, and gets it to the different parts of the tissues quickly. So what that's going to do is it's going to get that oxygen to the brain, and it's going to allow your brain to function at a higher level than it may be functioning now. So we call that exercise with oxygen therapy. Most people feel great when they finish their oxygen therapy treatment. The next part of the equation is glucose. Glucose comes in the form of the proteins, the carbohydrates, and the fats that you eat. So we like to make sure we have a very clean diet, and we don't want to be eating anything your body is sensitive to, which goes back to learning that from the metabolic side of the equation. So the glucose is very important, so we want to clean up your diet and make sure you're eating a diet that's right for your body and condition. Okay? Now, the other side is activation. So we like to do a brain-based therapies. Now that can either be adjusting one side of the body to stimulate a part of the brain that's not firing the way it should, or we could be doing auricular therapy, listening to music in one side of the ear to stimulate the other part of the brain. We can also do warm calorics to stimulate your cerebellum to get your body more stable. Cerebellum is the back part of your brain. It controls your postural muscles, your balance, coordination, and it helps fire opposite parts of the brain for several functioning. So what we have found is neurologically and metabolically, add them both together, you'll see your body and your symptoms get better a lot quicker than it would if you just do one or the other. So that's why we do both in our office. Now, after watching the video, learning a little bit about the thyroid and the symptoms that go along with it, if you think this may apply to you, then don't hesitate to come into our office and get a free consultation. Call our office, 972-422-2273. Speak with my front desk and get your 2 free visits. What we're going to do is, the first visit, we're going to go over a little bit about you, your history, any past blood work that you had, any x-rays you have. Bring everything you have in here so we can go over it. And after our exam, we're going to see you the next time where we're going to go over everything, let you know my opinion of what's going on with you and what we can do if we're able to help you. If not, then we'll try to get you a place that can help you. So I leave you with this. Ask yourself, what has your thyroid cost you in quality of life so far? And then where do you see yourself 3 years from now if you do not get help? Have a great day. Again, my phone number is 972-422-2273. We look forward to seeing you soon.